Dr. Joanna here with Momenta Chiropractic, and today I'm going to be taking you through part 2 of our series about sciatica. In part 1, we covered what sciatica is, along with some of the anatomy associated with the sciatic nerve, and today we're going to dive into how we diagnose sciatica and parts of the exam when we're doing a low back examination. First, we want to determine the characteristics of your specific case of sciatica. As we mentioned in the first video, sciatica can present in a variety of different ways. You can have isolated low back pain into the hip or the glute region, down the leg in different patterns, and even into your toes. There's also a variety of different symptoms that you can experience, ranging from pain, numbness, tingling, and even weakness in some muscle groups. So first we're going to test your lumbar range of motion, which looks like this. Go down and touch your toes into flexion. You extend backwards, and then you're going to do some lateral flexion from side to side, as well as rotation in different positions. Testing the position of your lumbar spine and seeing how that changes your symptoms. Does it intensify them? Does it relieve them? This type of information is really important for us, especially in the beginning phases of your rehab prescriptions, because it'll help us learn the positions that we want to avoid and the ones that we want to practice more repetitively to help bring some inflammation down and get you out of that acute or symptomatic phase. Next, we want to determine how well the sciatic nerve tolerates stretching and tensioning forces. So I'm going to have Dr. Green help me demonstrate this next test called the straight leg raise. And basically, it's exactly what it sounds like. We're going to lift his leg up from a straight position. So from here, we lift the leg up and see if that changes any of his symptoms. If it brings on pain, numbness, or tingling. We can even add a little extra force by flexing his toe down toward his shin to put the sciatic nerve in a fully tensioned position. If you remember, the sciatic nerve runs from your lower back all the way down to the toe. So by lifting the leg, we're fully stretching that nerve, which can cause irritation if there is some sort of inflammation or compressioning happening at the nerve root. So we perform this test on each side and see how that changes the intensity of symptoms. And then we want to monitor that throughout treatment to see if there's any improvement or any changes in the sciatic nerve. Lastly, we want to perform a thorough neurological exam. This includes muscle testing, a sensory evaluation, as well as deep tendon reflexes, especially in the presence of numbness, tingling, or weakness. This allows us to get a baseline evaluation of what your function is so that we can monitor that throughout your treatment plan. Those are just a few of the components of the exam when we're diagnosing sciatica, but I hope it demonstrates the importance of getting an examination to really explore the cause of your sciatica, because everyone's case is different. We need to learn the individual characteristics of each person's presentation so that we can formulate a treatment plan that includes in-office care as well as at-home exercises that's actually going to work for you. Thanks for tuning into this part all about diagnosing sciatica. Be sure to keep an eye out for the next part where we talk about the treatment of sciatica.